And now, please welcome our next session of the morning: how mental health affects you, your work, and your business. Please welcome back Robert Bard, who will be moderating this session.
Hi, everybody. Welcome back, everybody. And I hope that you did your breathing exercises, you got all the stress out of your body, and you're ready now to get out. Um, for the past few years, in reality, at all of our conferences, we have integrated something that is very important, and that is something how to deal with your mental health when you're an entrepreneur. And this will help you whether you're an entrepreneur or not. But the fact is that with the advent of the COVID-19, most of us have experienced severe stresses in addition to all the stress that you experience all the time being a Latina or being a small business entrepreneur. Um, it's very, very difficult to be able to maintain yourself focused, to maintain yourself healthy. So what we have done for the past year and now we will continue to do in the future is make sure that we provide you some tips and maybe even some tools on how to be able to control your stress, and what are some of the telltale signs that will let you know that um, you're getting stressed out, because the signs may not be as obvious as you think. If you don't sleep for 3 days in a row, you know that the sign is there. But there are other signs that you may not. Are you forgetting a lot of stuff? Are you getting very, very short on temper? Um, so we have asked a distinguished group of experts to help us bring this to you. And I would like to introduce you to the panel that will actually help us with this. And first, let me introduce you to Gabriela Romo, who's a radio show host and producer and owner of licensed clinic counselor columnist. We also have Gloria Sáenz, who's the owner and lead clinical therapist at Salud Vista. Um, and Vita, Salud Vita, a little bit of Latin there, I think. And Jennifer Peña, who's the chief medical director at NERCS. So let's begin by introducing our panel, and let have them introduce themselves first. So let's begin with Gabriela Romo.
Thank you very
Gabriela.
much. Yeah, thank you very much, Robert. It's a pleasure to be here. I'm actually a small business owner, Latina, immigrant, mother, wife. So I feel like very reflected with everything that's going on. I have my own private practice, and also I have a radio show that is only about mental health every week. And so I have the opportunity to listen to Latinas, to Latinos who are struggling with mental health. And that, it's definitely something super important these days. Well, always, but particularly since the pandemic, as you mentioned, Robert, this is so important. I'm very glad to be here because not only we're breaking the stigma about mental health, but also this can make a huge difference on each person, not only at personal level, but also in the other areas of their lives. Thank you very much, Robert.
Thank you, Gabriela. And now let me ask our next panelist, Gloria Sáenz. Gloria, good morning. Could you please introduce yourself?
Absolutely. Good morning, Robert. And thank you so much to Latina Style for this opportunity. An opportunity to talk about something that I'm so very passionate that's what I live, right? Is to be able to impart and to get folks to kind of tap into living out their best lives yet. Robert, I'm impressed. You knew that's Latin, and that's what Salud Vita means, best life. And that's what I believe that each one of us has the capacity to do. And life comes and throws things our way, and yet we're able to learn some management and to overcome those obstacles that might come in our way. I recently read a quote that said, what mental health needs is more sunlight, more candor, and more unashamed conversation. And I am so thankful for today, because today we're doing just that. We are shedding more sunlight. We are having more candor, and we're having more conversations, unashamedly conversations on mental health. And I do cherish this and believe it is a privilege to sit here with my Latina fellow women as entrepreneurs, as I myself have a small business. But I want to say thank you to each one of you, because we are partnering together to make a difference in our world, in our communities, and in our environment. And I also want to make sure that if you hear anything from me, that in order for us to be more effective in those areas, in our businesses, and as much as we want to give to others, we first have to give to ourselves and not forget ourselves in the process. Thank you so much for this opportunity.
There, I find the right button. I'm back. And finally, let me introduce our panelist that will be joining you. And she is somebody that's been with us before, so she knows Latina Style. And so Jennifer Pena. Hi, Jennifer. Would you please introduce yourself?
Yes, good morning, Robert. Thank you so much to you and Latina Style for inviting me back. It's truly an honor and privilege to be here, especially with my co-panelists, Gabriela and Gloria. I'm currently working as the Chief Medical Officer for a company called Nurx, which is the US largest, most trusted digital first and female-centric telehealth company. And our aim is to bring down barriers and destigmatize access to care, especially, in things that are sensitive healthcare needs. And mental health is very much one of those sensitive healthcare needs. Prior to that, also an Army veteran for close to 15 years, where mental health is very much at the forefront of our service men and women and issues that we have to tackle in the Department of Defense and the Veterans Affairs. And so mental health care and access are topics that are near and dear to my heart. And now being in the civilian sector and in a position where I can help bring down those barriers to access to care is very important, especially with COVID really highlighting the need for telehealth services and services that allow for access to care when we're not able to do it in person. And so especially in those marginalized communities here in our country. And so anyway, very happy and proud to be here today to share with all of you and empower Latina small business owners across the United States.
I'm back. Hey, do you ever find that your cursor doesn't go where you want to in your mouse, and you're looking and trying and it won't go? Well, that's what happens to us, the older guys. We're definitely challenged. Thank you so much, Jennifer, for being here. And like you indicated, you've been with us before. And thank you for your years of service and for your years of dealing with these issues of mental health, especially in such a difficult environment as the military. We are looking forward, and we haven't even told Jennifer yet, but we are looking forward to bringing Jennifer back with us when we do the National Latina Symposium, in which we recognize Latinas in the military service this September 23rd here in Washington, D.C. So, one thing that occurred to me fastly is that I want to ask the three of you actually, how, and I'm going to begin by going this to Gabby. This is not a question that I gave to the panelists prior, but how important is humor? Try to inject humor in your life. So Gabby, what do you think?
It is super important. It is super, super important, because if we just, let ourselves to be grim and down, we are not adding anything that lifts us up. So humor is a perfect way to actually deal with the stress, to deal with difficulties. If, sometimes as we say, like either you cry or you laugh. So it's better to laugh. And actually that just makes everything lighter in life. So please add humor. It is super important. I actually was gonna say that as one recommendation, Robert. So we are synchronized totally. So humor is important, bring it on, and be surrounded also by positive people. And many times those, more optimistic and positive people tend to be, like add humor into their lives.
Yeah. Well, thank you so much for that, Gabby. And let me go back to the question actually that I'm supposed to be asking. And please don't get distressed with me. You know, I'm known to ramble a little for rambling a bit. So if I get off the script, just bear with me. I'll get back to it. So Gabby, what are some of the signs? I spoke briefly prior, you know, some of the subtle signs that you're experiencing levels of stress that are beginning to really interfere with your life as a whole.
Absolutely. I think this is a great question because many times we don't know how to recognize when it is something expected that we think that, oh yeah, this is normal and this is, you know, I'm nervous and that's okay. But other times we don't know when this is really expected or we're really talking about something more serious. And so when we talk about mental health, we sometimes tend to think that it is only about our emotions, our, you know, our thoughts, but not really. Everything is connected. We are complex human beings. And so, you know, we will see signs in our body, we'll see signs in our behaviors, also in our emotions and our thoughts, as I said before. So for example, if you notice that you are gaining weight, for example, or losing weight without dieting, or having more headaches, stomach problems, you're not sleeping well, or not being able to maintain sleep, we're talking about some signs. Also, for example, when we're talking about our emotions, we're not feeling right. We just feel that we are a little bit more sad or excessively sad or more nervous, worried about many things. We, for example, have mood swings or get more irritated with people, less patient. And then we're also talking about signs. When we talk about our thoughts, for example, a person can have suicidal thoughts, and then we're talking about something much more serious, more severe, like, you know, severe depression. But also we can't concentrate well. And all those sort of things, we see them reflected in our relationships, at work, also in our personal lives. And I forgot to mention too, so that the behaviors, and what I mean by behaviors, for example, is that we're eating in excess, or for example, that we are avoiding seeing friends or avoiding doing things that we used to like. And so that also means that there's something that is not well. Now, people probably will ask, well, yeah, everybody has felt like that at some point. Well, when we're talking about something more like a mental illness or a mental health issue, we're seeing patterns. One day feeling like this, it's okay, but we're seeing probably that, you know, most days rather than not, we are feeling that way or we're seeing these signs. Then this is a time in which we're thinking that, you know, a person needs help. So be aware of all these signs, but also maybe we don't see those in ourselves, but we'll see those reflected on how we interact with our peers, with our kids, with family, or that we cannot be able to, you know, to have to be ourselves as we were before. So this, I would say that in a nutshell, those are some signs. And of course, each mental health issue will have its own symptoms, but in general, these are like some signs, Robert.
So thank you so much, Gabby, for that. And Gloria, so if you're beginning to see these signs, what are some of the tools that we can use to begin to reverse this? You know, because I think, you know, some of the tools that I personally use is to get rid of all extra negative people and extra negative friends out of the picture. But Gloria, what would you recommend that we beginning to look how to manage this?
Well, thank you. And I too appreciate the question. I first want to go back to your other question about humor, if I could interject to that one. One of the good things we don't realize about humor and all this, there's chemicals that are happening in our brain and actually in our stomach. And when we laugh, we're creating serotonin, we're creating connection, oxytocin, and that actually helps also with this thing that we call stress, but it helps change our mood and gets us in a better mood. All right. So being around those people, being around humor, actually, again, we know research wise really does impact and has an impact. So using humor is important. Going on to stress, one of the things I do want to mention before we talk about some tools is, and actually this is part of a tool, is recognizing that stress in and of itself isn't bad. After all, stress really is just our body's way of responding to anything that's going to require some action or attention. So stress can be good. Stress is what gets us to the finish line. Stress is what gets us to pivot, right? To think outside of the box. Good stress is also the stress that helps us manage relationships, to include with employees, with our partners, with our children. So there's good stress. Gabi mentioned, and she gave us that list of what bad stress does to us. And again, stress is your body's reaction, and that's really important to recognize. It first happens in your body and it gets manifested externally, and it could be through behaviors. It could be, again, some of those things that Gabi mentioned already, headaches. Even Robert mentioned how we forget things. We may be having some more accidents, like we may be tripping, may even be a little more clumsier than we have been usually. So those are going to be those signs of bad stress. So again, first recognizing that stress in and of itself isn't a terrible thing. It's actually could be good stress or it could be bad stress. Recognizing some of those signs that Gabi told us with the bad stress. I love it because Valeria already gave us a tool on how do we manage. And again, what I want to say, let me back up, is that I don't really see it as controlling or reversing stress, because stress is a part of life. So it's managing stress. How do we manage stress in our life so it doesn't become the bad stress? And again, the square breathing, I love it. One of the things that I do and I practice with my clients is breathing. Another tool we can do, again, and that regulates our nervous system and helps us manage things and perspective. Another tool for the breathing, and there are several tools, you can also go to some apps, is to take 5. And taking 5, and you can do it with me as well, is we breathe in and we breathe out. We breathe in and we do it slowly and breathe out. We breathe in and we breathe out. And we breathe in and we breathe out. And we breathe in and we breathe out. So taking those breath breaks. The other tool that I recommend is setting intention for your day. I don't know what your morning was like, but my morning didn't quite start out with intention. I started thinking what I had to do today. My daughter's home from college. We have one car. She needs to be someplace. I need to be someplace. I poured myself a cup of coffee in a nice mug. Couldn't enjoy it in the nice mug. I had to put it in a to-go cup. You get the energy that I'm emitting? And I'm just going and I'm, okay, I need to be here and I need to do that. And I had to go back to my break, whether it's the square breathing, and go, wait a minute, what is my intention for the day? And the way I do and set the intention for the day is I do put my hand on my heart. And I go, what do I want my day to look like? Instead of the day happening to me, I want to be the active participant. So I put my hand on my heart and I set that intention. May I walk in wisdom today? May I walk in kindness? And may I walk in love? And I use that tone of voice for myself, offering myself that self-compassion. So we want to take our breaths. We want to set the intention. Another recommendation is get your body moving. In our virtual world, I mean, you can even practice this right now. What does your body feel like? We sit in front of our computers and we're told we have to keep our cameras on, right? So we're sitting like here and we're like, okay, do it right now. What does it feel like when you just move your body? Feel the difference. This is tension. This is stress. whatever, dance. It might be too personal. When's the last time that you just danced in your underwear in your house? Might be too personal for some, but that freedom, that movement, the dance, and we know that music also has, again, it's gonna help release that stress. It's gonna help create and calm down our nervous system. Get that body moving, dance. If you have to pull the shades down, pull them down so nobody sees you, get your body moving. The other thing is reach out. Because you reach out doesn't mean that you're weak. Because you reach out, it doesn't mean that you're not professional enough. And we heard it. It doesn't mean like I don't, because the fact is we don't know everything. When we reach out, whether to a friend, whether to a mentor, whether to a professional, a counselor, or a therapist, we're saying, soy ser humano, I'm a person, and I don't know everything. The community, and this is one of the reasons why I love even Latina Style. We have our chambers and we have various organizations because they're saying, you don't have to do this alone. We're going to come and journey with you. We're going to help equip you, right? We're going to help support you. We're going to listen to you. So the 4 things I would mention, or actually 5, first, recognizing that stress is not necessarily bad, that there's good stress. Number 2, taking those breaths, taking that time. Number 3, get your body in motion. And number 4, reach out.
Those are really, really, really good points, Gloria. You mentioned briefly music, and I want to say something from my point of view. I created a file at the beginning of COVID that is my 10 power songs, my most favorite songs of all time. That is like, it's like oldies, and nobody recognizes these songs, by the way, because I've been around for too long, but they are my 10 power songs, and they really, really helped me. Jenny, you've been, I cannot even begin to imagine for exactly the kind of stress that you have faced, but you, in your profession, you've been on the front lines. You were in Afghanistan, and because of the experience that we've had with our daughter that was deployed to Afghanistan, we have a little bit of understanding, a very little bit of understanding of what that must be like. I'm supposed to be asking you about COVID-19, I know, but I want to know, how did you transition, that kind of stress from the military on the front line to the kind of stress you see today, in your job?
Yeah, thank you, Robert. And I love that you call me Jenny because my family calls me Jenny. So it makes me feel right at home in La Casa here with my Latina Style family. I will go back really quickly before your question, just like Gloria did to the humor question, because I use humor a lot. And one time I got criticized because I was told that I was using it to deflect. And I actually said, I'm not using it to deflect. I'm using it to reflect on my emotion. And the way that I'm feeling and trying to channel it in a positive way. So I just wanted to leave you with that anecdote. But, it has been very challenging. I just left active duty service in 2019 after, what was close to 15 years of active duty service. Had a very challenging, professionally challenging last duty station at the White House, where I served as physician to the vice president. And I don't have to explain to you all how challenging that kind of an environment is. And the dynamic of coming from somewhere downrange and then switching to a military duty station that was very different in nature. I have to say that it's like my fellow panelists have said, is being able to reach out for help. It took me a long time to admit that I had some anxieties from my time in service. And I'll admit here that I actually do suffer from a certain degree of PTSD. And I was very ashamed of that. I always considered myself to be a powerhouse and driven and professional. And I saw it as a weakness. And it's sad because as a medical professional, I expect from my patients to not see it as a weakness, but we all know medical providers are the worst patients. And so I wasn't able to admit it for myself. But I was able to eventually seek help through the Veterans Affairs system. And I'm very grateful. They have taught me many exercises like square breathing and mindfulness minutes, which I used to joke about and thought that it was kind of poppycock, but it's actually quite helpful to take a minute at the beginning of your day to find one actionable item that you can do in the day and feel like you've accomplished something. So really, yeah, seeking help is huge. Not feeling ashamed, understanding that mental health is just like any other medical condition. You have to treat it, and it has almost like a dual effect, because it doesn't just affect your brain and your emotion. It, as Gabriela mentioned, it has an ability to manifest itself in systemic illness and systemic ways, and even worse in other things that might be going on. And so, again, just being able to bring down those barriers, that stigma, and destigmatize. And it's really, something that, again, in my current company, I'm really proud of the work that we do, because we aim to destigmatize those conditions that people tend to be ashamed about, and cause so many long-term sequelae, not only for health, but also for business, for economics, for the role of our women in our communities and in our families. And so, yeah, it's a challenge, and it's a challenge, by the way, I should say, that doesn't go away. You have to work at it every day. It is a chronic condition. So that's another acknowledgement that we need to remember.
Thank you for that, Jenny. Let's talk a little bit then, without pontificating, I hope, about the big elephant in the room, about what's going on with COVID-19 and with the vaccination. I see medical professionals on both sides of the aisle. Some saying, you should have been vaccinated already, or others say, let's wait to see that we all become, immune. So tell me what you're seeing, because you're on the front line. You're still working with that, today. So Jenny, what do you think?
Yeah, so it's a great question, because it's, as you said, a controversial topic right now. It's interesting, coming from last year where we all wanted that golden ticket, that escape from this pandemic. And now that we have it, it's an issue that has caused a lot of difference in opinion, not only from the lay community, but the medical community as well. What I will say is this: we have to be objective, and we have to follow science. That's always the most important thing, and remove all subjectivity from the discussion. There is a twofold way that I see this issue with vaccination. It's an individual, and then it's a collective. For the individual, we know the science has told us that this will protect you from COVID. And even if you do get it, it will protect you from the severity of the illness. So the morbidity and the mortality go down, and also helps the spread, control the spread of the disease. From the collective, and one other quick thing, we do know that there have been some adverse side effects to certain of the vaccines. So we do have to make sure that we continue to follow that data. But for the majority of people, it is safe. On the collective side, it's about controlling the disease so that we can control the pandemic. We're still in a pandemic, mind you. We still are in a pandemic. But what we are going to hopefully be able to do is make this endemic disease, not pandemic. Meaning, just like the flu, just like the other coronaviruses that cause the common cold, yes, there will likely be a need for yearly vaccination or booster vaccination. Yes, we still don't know what the variants do and how much these vaccinations or immunity from having had COVID protect you. We don't know how long yet. There's a lot of unknowns still. But what we do know is that hopefully with either herd immunity by enough people being vaccinated, or having natural immunity from having had the condition, that we will reach a state where this will become endemic, and we can protect it in small pockets and not allow it to leave those small pockets and cause what happened last year, which much more bigger effects that then affected not only our health, but then our communities and our economy. And so that's what I would encourage people to do, is think of it in that way. How does this affect me as an individual? How does this affect me as a member of a community? And then what are the long-term effects of me making a decision to either get it or not? And again, just follow the science always.
Thank you. Gabby, you are a broadcaster. You have your own radio show. How many questions do you get from your from your listeners about, about mental health?
All the time, all the time. And is many times it's not only about like recent things that recent changes that they notice, but also of things that even happened when they were kids, or that they've been, you know, dragging for years, or sometimes they don't even understand that this is mental health, but they have these questions like, you know, why do I always, you know, follow this pattern, or why do I always end up having, you know, bad relationships or anger issues, or, you know, I can't stand my kids anymore, or at work I'm like all the time I having issues. And many times, you know, then realize that, hey, we're talking about something that it is about our emotional and mental well-being. So this is a constant. So this is that's why I'm very glad that you're bringing this up, Robert, these topics, because it really affects every aspect of our lives. This is like a building block, basically, for any of our, you know, the activities that we do, the things that we want to do, the, you know, members of a community, of a family, or just all individuals. So this is great. But going back to your question, yes, all the time, Robert.
Well, you know, that means anybody who has any kind of public audience, you know, should at least be educated enough to be aware to said that these issues can happen, and you know, without trying to become a doctor yourself and, you know, being Mr. Google out there giving medical advice, which, you know, a lot of the people do. You know, we see that, you know, in our friends, we see that in our family, that they Google something and all of a sudden, you know, in every potential warning that may exist for any kind of illness, you know, is on Google under 1,000 different illnesses. So I don't think that even the doctors know, you know, exactly what Google's saying. Balancing your lifestyle on this. I mean, give me, you give us, Gloria, you give us like 4, you know, or 5 key issues that you really need to be at least be aware of, and how to, you know, try to control the issues that affect your mental health, and for people to basically understand, you know, don't wait till you hit your husband over the head with a frying pan, or you throw the kids out the window to recognize that something is happening. What are some of the key, and you may reinforce what you told us already, Gloria. What are some of the key actions that you should take?
One of the things, and I had mentioned and I wanted to make certain that we talked about, or what stress was. And it is the body's reaction, first and foremost. So one of the tools that we do want to do is recognize what's going on in your body. And that could happen again. You gave the example, we're going to go with it, Robert, you know, hitting your husband or your partner over the head. Before you pick up that frying pan, something has happened in your body. You started to feel tension. Maybe your fists clenched up. Maybe you started to feel that knot in your stomach. Maybe you noticed that your heart started to beat really fast, or that your breathing became dysregulated, right? So listen to your body, because your body is going to tell us what you're feeling. Your body's gonna tell us what many times your words cannot express. I'm getting stressed. I'm feeling overwhelmed. What happens, though, Robert, often is that we are not paying attention to our bodies, that we are indeed reacting instead of responding. Stress first starts in your body. Notice we mentioned, I'm not sleeping well. Notice that, yeah, my mood and the people around me don't really want to be around me anymore, right? That when I go speak to my children, they're kind of flinching. And that could be an exaggeration. So notice what's going on in your body. And again, we live in such a rushed world that we forget, or we just are not attuned to what's going on with us physically. Slowing that down, getting to know what it feels like. That's why those beautiful practices of mindfulness, those practices of breathing, what it helps us do, it helps us recognize and readjust, if you will, and we go like, wow, this is what it feels like to be calm. So that when we start to become not calm, we're like, oh, I don't like this. I have a beautiful example of working with a client who told me at the beginning, well, I'll tell you what she said at the end. At the end of our therapeutic time together, she is like, Gloria, I can feel the clothes on my body. Why is this important? Because for the longest, with the stress, with the anxiety, she wasn't in tune with her body to be able to get to the point where, man, I feel that material on me. That was huge. Because again, that's going to help us regulate and manage that nervous system. Get in tune with your body. Listen to those that you care about when they start mentioning, hey, you don't seem quite right. Something's off. Again, reach out. Don't look at it as a criticism. Again, it's not, I'm weak. It's, I'm a person and maybe I am stressed out. And sometimes we think being business owners, being women, some of us are moms, we're business owners, we're partners, we're in the community, we're this, we're that, and we think we need to be all things to all people. We're humans.
Yeah.
Offer yourself self-compassion. That's another big one. We're not offering ourselves self-compassion. We feel like, again, we just need to keep going. I can't stop because and I promise you, the world will not stop because your business is not going to falter because you take a 5-minute break. You're not going to miss out because in fact, you will be more attuned. You'll be more energized. You'll be able to tap into the good stress and be so much more effective when we take that time, getting attuned, knowing what our body is feeling like, listening to those around us, right? And again, reaching out.
Thank you so much, Gloria. And that is so true. Gabby, you know, your audience, what is the most significant issue that they call you with?
For anxiety issues, that's quite common. And also recently, Robert, I've got quite a large number of people that went to their medical doctor because they complained about not being able to breathe well, chest pain, stomach pain, and they went through a battery of tests, all sort of assessments, and it turned out that it was anxiety. And they thought it was probably a problem with their heart, with their stomach, you know, many people actually sometimes think that they're having a heart attack, and actually it was a panic attack. So, but I'm seeing this more and more recently. And that's kind of like the last resort of, okay, because my doctor told me to go and see, you know, a therapist. But they didn't know, you know, it's like, because we are more educated to go directly to see a doctor if there's something with our body. So, but it turns out that it's like, no, it's actually all about stress, anxiety. But definitely anxiety would be like number one, and then would be depression. That would be my top two mental health issues that people complain the most.
Jenny, you know, now that Gabby mentioned depression, that is one of the main flags that you see when there are PTSD issues, right? How are you doing with, you know, how you said that you work with your PTSD and you think you got it. I mean, you say you have it under control, which I'm very happy for that. How did you do it?
Well, I will answer that question. I just want to piggyback something that Gabby said. You know, it's interesting as medical, I'm an internist by trade. And so, you know, as primary care providers, we see this all the time as well. But as she mentioned, mental health is always a diagnosis of exclusion, right? We still have to go through the battery of tests before, you know, to rule out organic disease before we consider mental health. But what I aim for with my providers is always to make it a diagnosis of inclusion, always to make sure that they always keep it not in the back of their minds as the last diagnosis, but as one of that could be the first. So I just wanted to say that. you know, it's hard, Robert, because it can manifest PTSD in many ways. Anxiety and depression are very common. Insomnia is very common. Anger is very common. There's many symptoms that come with it. Avoidance, for me, it was probably the most present symptom, just trying to avoid the things that I knew would trigger those emotions. And part of, I'm not a psychiatrist or a psychotherapist, but I'm in good company here. But, you know, obviously part of the treatment is also, you know, exposure therapy and trying to get to that point where you're okay to face those things that brought you to that place in the beginning. And so that's really been the most challenging, but the most beneficial of the treatments for me. And again, it's a constant thing, you know, it's a constant struggle that you have to continue to do it. But it's like running a marathon and training for it. You have to continue to work at it every day and get that brain muscle trained to be able to tackle those triggers. And so I just think, but it doesn't manifest the same way for everybody. So I just encourage anybody who has any concerning signs or symptoms to, again, acknowledge them and reach out for help. It's not a shameful thing. It's actually a very proud thing where you're able to acknowledge it and admit it. And it's to the point where I'm sharing it with perfect strangers now, because I think that it actually encourages people. And I'll say in the workplace and for our small business owners, always consider trying to give these resources to your employees, because a happy employee and a mentally healthy employee is a much better employee. And so one of my initiatives at work too is not only to treat our patients that are coming for care, but also to come up with resources for our employees. And being forthcoming about my own diagnosis actually has helped a lot of my coworkers and employees come out with their own concerns as well. So yeah.
Well, thank you so much for that. And they have given me the hook with the look. That means that our time has come to an end. But please, if you're so kind, and we will do it in the magazine, you know, and we will do it online. Provide us with a way that if you would like our audience to get in touch with you, send me some contacts. And the final thing that I want to say about stress, something that has worked incredibly well in our family. You know, our two little dogs, Eggie and Wonder, are a tremendous source of relief, of laughter, of love, of unconditional love, by the way. You know, it's very seldom that you get that. And the only time we have to jump is when the mailman, because they come to the office. The only time we have to jump is when the mailman comes to the door, because they go crazy. Everybody else, they absolutely adore. So thank you so much, ladies. We look forward to staying in touch.